Christine von Raesfeld lives with serious illnesses.
Autoimmune, genetic issues.
She spends a lot of time in hospitals and on her healthcare providers' websites to learn more about her conditions.
I'm looking at the potential for research.
5 years ago, Christine says, she began to notice more and more medical ads popping up on her computer, recommending treatments for the very conditions she was researching.
I was now seeing ads that were targeting me.
But targeted ads, Christine says, would likely involve hospital and healthcare sites collecting and sharing her health information. And that's prohibited by the Health Insurance Portability and Accountability Act, or HIPAA, a federal law to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. Christine says she had no disclosure and certainly didn't give her consent. But increasingly, she suspected her medical information was being shared.
This information was being collected.
Attorney Alex Honeycutt came to the same conclusion.
Are we being spied on?
Undoubtedly.
Honeycutt constantly searches computer coding on healthcare provider websites.
So it's tracking what you're using?
Yes.
Finding evidence that confidential health information is being collected and shared across the country.
That's scary.
It's incredibly scary, and it's scary because it's invisible.
Honeycutt says it happens with the help of a simple piece of code offered as a free marketing tool by tech giants, which is embedded in hospital and other healthcare provider websites. One of the most popular tools, she says, is Meta's Pixel. While Meta warns that Pixel is prohibited from being used to collect and share information about an individual's physical or mental health, Honeycutt says it's up to the hospitals and healthcare providers to make sure that doesn't happen. And in case after case, Honeycutt says, she can prove it does.
Yeah, it's really astonishing.
We turn to a computer expert to show us exactly how it works.
Do you know how they know?
Yes.
Kevin Lewis is the owner of Media Stew in Cincinnati. To reveal the inner workings, Lewis set up a mock medical site, which he embedded,
With the fictional pixel that I set up with it.
allowing third-party cookies to track
It puts a bullseye on you, yes.
and share everything, including protected medical information.
You're having some search here about cancer
Right.
going on.
Yes, exactly.
They know that.
Yes, they know that. Now they can link exactly my user ID with the fact that I'm looking up cancer.
Back in the real world, Honeycutt and other attorneys have filed at least 18 class action lawsuits against hospitals and other healthcare providers in 24 states that involve an alleged illegal and widespread practice of disclosing confidential, personally identifiable, and protected health information affecting millions of patients.
It makes it really difficult for people to trust their healthcare providers when they sit there and wonder to themselves, is there a back door where they're sharing this information?
And you found out.
The answer is yes, oftentimes.
For Christine, who's also a patient advocate, the lawsuits confirm her fears that confidential medical information is being shared.
We expect that we have some level of privacy. Do we?
I don't think we do.
Do you feel violated?
Yes.
You can always find our local 12 stories right here on YouTube. Don't forget to tap subscribe, and then you can get all the notifications.